to Talk with Healthcare Heroes, Episode 7. Today, the topic of talk is nurses' approach during unprecedented times. Nurses have been really struggling during this time. Today, I have with me Miss Merlin James, who will be sharing about her experiences, approaches that a nurse can implement during the unprecedented times, and the opportunities the nurses have in UK, United Kingdom. So tune in. Welcome to Talk with Healthcare Heroes, Episode 7. I have with me Miss Merlin James, who will be talking about nursing approach during the unprecedented times. She was a lecturer in one of the famous colleges in Delhi NCR, Jamia Hamdard, and now she's working as a nurse in one of the NHS trusts in UK. So welcome, Miss Merlin. Those who are watching us online, please comment below so that we know that you're watching us. And so our viewers would love to know you. So my first question to you is that you have raised a generation of nurses. So how was your experience?
All right, so that's a very good question. Teaching has been my passion since childhood, and you won't believe that. When I was a student as well, whenever I used to get an opportunity to teach, so I used to make use of an opportunity. So when I got into nursing, so I was exploring, avenues where I can teach. So after nursing, I worked for a year as a staff nurse and then as a clinical instructor. So there was always a quest of learning more, and so that's why I like teaching, because when we teach someone, we also learn from the person whom we are teaching, right? So that's how I got this interest into teaching, and then I pursued my master's. So after doing my master's, I got the opportunity to work in the same college. So as you said, a generation of nurses, I don't know how many, but I worked there for 5 years, and I would say it was a very gratifying and rewarding experience, because you might not always get a thank you for what you do, but you know what, the work which you do and the impression which you instill in the heart of the students, that would be echoed in the future, not probably soon, but in the future, right? So it's always a gratifying experience, right? And the other part I like about teaching is, you can influence people. Understand? So it's very important for a teacher to make sure that she leaves a positive influence on the students, not a negative one, because she should be an example for others to emulate, right? And the other interesting factor about teaching is that you are, every day is a new experience. I mean, so probably today there would be one batch, the other day there would be some other batch, right? So there is new minds you're working on every day. So the novelty aspect is there. So, that helps us. And the last thing which I would like to tell you is that teaching gives and builds your self-esteem. Do you, and I'm sure, and you also might, after doing all these interviews, you might have also gained confidence. So when you're standing in front of an audience, automatically your self-esteem, it boosts. So yeah, so in short, I would say it was a gratifying experience for me. Yeah.
So she's one who had guided me to do my master's in that college, and she's been always a support to me. And also, she was my teacher and was always ready to help in everything. I remember I was coming to you for research, and you were helping me out with the statements. So thank you for everything that you have done. And like you said, a teacher should always show the positive aspect to the students, or they should have a very positive feedback about them, even if there are tough times with the teachers, but it should later benefit these students. So how, like, now you're a bedside nurse there, so how difficult was it, like teaching in a very good institute in one of the Delhi NCR, and going as a bedside nurse in the hospital there? So was it difficult, or how was it?
Well, when I made this decision to move from Jamia Hamdard, it did raise eyebrows of many, So because I was well settled with my family and I was happy with the work there. But as I mentioned before, I was always in a quest to learn more. So, I was a person who used to explore more, and so PhD was always in my mind. But I was not in a rush or a hurry to do PhD, but I always wanted to do it from a very good institute where the quality of education is good. That doesn't mean that I'm denying the fact that India doesn't have good education institutions, but my husband was the one of the motivating factors. So he was like, you should not do it from uh, you know uh, institution wherein the quality is not good. So we were trying to find out opportunities, and that's how this UK thing happened. So in order to do that, I had to go through this. In fact, I'm going through that process of bedside nursing. So what I felt is, like, when we are again with the patient, you get to learn more. And rather than, because teaching had been a gratifying experience, but then many a times I also wondered, what if I was there with the patient, and there are many things to learn more. So when I've come to UK, I've learned so much. Probably we can have a chat over that some other time, what I have learned. And now I'm a surgical nurse. I was in maternity back then, so it was an medical surgical always used to interest me, but then I didn't get into that. I was into maternity. So surgical, being a surgical nurse, I've learned so much in this past, I think so 10 months now. And there are student nurses as well in the hospital. So my senior staff, they make sure that I am assigned with the student nurses in a bay, and I get the opportunity to teach them. So I've not lost the touch of teaching. So I'm still pursuing teaching here. So my plan is to pursue PhD sometime soon, but just waiting for the right time. So I'm happy with my job here.
Wow,
So
that's great.
yeah.
So, what do you think? Like in this time, do you think that nurses have got recognition more?
Well, I would say that nurses are their work is indispensable. I guess you understand the meaning of that, which means that they are the major workforce of the healthcare system, right? I mean, they are the in everything. We cannot omit nurses when healthcare comes. The word healthcare comes, nurses are an integral part of that, right? But ironically, they never got the recognition which was due for them. Nurses, they've never got the recognition. Yes, there was Florence Nightingale Award and all of that, which did give recognition. But then never in a newspaper or never in a news channel you would see a brave work of a nurse being highlighted. You understand? But then coincidentally, WHO declared 2020 as the year of nurse and midwives. And it is this in this year that the world saw this unprecedented crisis of coronavirus. And it's during this time that the work of nurses is being discussed and appreciated. Okay. And you might have seen in the news channels that there's no other option for these anchors not to tell the word nurses, although they are like doctors and paramedical staff.
Yeah.
But then now it has come to doctors and nurses. So now they're forced to bring that term nurses in their mouths during an interaction. So one word that has captured the attention of the uh, media across the globe is frontline warriors. You might have heard that, yeah, frontline warriors. And it would not be an exaggeration to tell that nurses are first among the equals in the frontline warriors. So I really feel that the time has come, and it's the right time for nurses, and they have got the due recognition, although quite late. But yes, their work would be appreciated in these unprecedented times.
Wow, that's great. So,
Yeah.
like, what do you think? Like, I feel that nurses in India is not recognized as nurses in abroad or any country like UK, Canada, US, Australia, but the recognition is not same in India.
Hmm.
So,
See, when back I was in India, we used to always read, nurses are the cornerstone of the healthcare, nurses are the integral part of the healthcare system. But somehow I could never relate to that, because you understand, you have also worked as a nurse and you're teaching, and you might have also you would also echo the same. But when I've come to this place, I've understood one thing, they're actually the integral part of the healthcare team. Because when the doctors come for the rounds to see the patient in the morning, in India, back home, we never saw a nurse in that team. Have you ever seen a nurse being in the consultant round? No, we have not seen. But that is what I have seen here. There is a nurse practitioner in that team of the healthcare team, whose decision is valued, and their contribution is valued. They are more respected. They are getting more pay. You know, work-life balance is there. Everything is there. But then probably what I would feel why Indian nurses are not recognized much back in India, in their home country, is maybe we nurses have not, made a mark or done something to change that status. Uh, because if we are, like, for example, in one of your interviews, you did talk about research, right? So the nurses are doing research, but they are like so laid back to get it published. Understand? So it's very important to publish your work, and to show what you're doing to the outside world. And there should be leaders. So when I tell about nursing, it's like it's from bedside to the boardroom. And I appreciate you, Ansi, for this work of interviewing people, because this is a kind of a leadership. So nursing requires leadership. We are happy to be at the back and do the work, just silent workers, right? But to lead is what is important. So leadership is missing in nursing, and research should be more strengthened, and nurses should play an equal role as the doctors in the healthcare team. So the healthcare organization should also recognize that nurses' commitment and their dedication is also important. So that's what is missing, I feel.
I think they should feel more empowered.
Yes, true. That yeah, very important, very empowered. They should feel that they're the part of the healthcare team, not just working in isolation. They are the part of the healthcare team. Yeah.
So my next question, like, what can be the approaches that nurses can embrace during this unprecedented times?
Well, that's our topic for discussion today, right? So you might have heard of a phrase that when life throws you lemons, make a lemonade. You must have heard of it, right? So, but it is easier said than done. When life throws challenges and what do you say, precarious situations and problems, there are situations that we just lose all our hope, right? And we might just set back, go back, quit, right? But we need to understand that it's during the unprecedented times that our work matters the most, our contribution matters the most, right? But in that time, if we walk away from that, we are kind of obliterating that growth process. So as a nurse, what I feel is that we can't avoid change. So change is imperative, right? And when I talk about change is an opportunity for growth. So you might have also come across with two categories of people. One who are very defined to change, like when something change happens, they get just so anxious, and these are the kind of people who also do not appreciate change in others, right? So if, for example, if you're doing some good work, there would have been category of people who might have appreciated your work, but there might have been people who have not come in the front and said, well done, Ansi, right? And they might have tried to probably pull your legs down and do things wherein you might be demotivated to do your work. So these are the people who are defined to change. They don't appreciate a change in an organization. They don't appreciate change in an individual. But there are categories of people who embrace change, right, with open heart. So they embrace change. So that people who embrace change are the people who can accept the change, right? So what I mean to say is that change is inevitable. Nothing is constant. Change is the only thing which is constant, right? So what I feel is that the first approach for nurses is addressing your personal conflicts. Now, what can be a personal conflict during a change? As I said, when change comes, when unprecedented times come, so you're baffled, you're confused whether you should quit your work or you should stay, right? So in that condition, as an individual, what is your take? Would you embrace the change or would you leave the battleground? You understand? So it's a conflicting situation. So when we are in nursing, we are what should I say? We have the heart to take care of the patient, but the circumstances are not so, which help us to take care. Like, for example, the nurses, we are facing the problem of lack of personal protective equipments, lack of support, lack of training, lack of encouragement. So, and a shortage of staff, so much workload, so much is there. So as a human being, there is chances that we can quit the battlefield, right? But holding on to that rope of confidence and hope that change would bring something good. So it's very difficult. It's very difficult to say in words until we are actually in that field and experience it, right? So I think, so for addressing the personal conflicts, one need to have a good emotional intelligence. And now, what is an emotional intelligence? It's a conglomeration of self-regulation, self-acceptance, and self-awareness. Now, if I know that what I am capable of, and if I accept what I am, and if I accept these surrounding, it would be easier for me to deal with the changing circumstances. So I think the first approach is addressing the personal conflict, right? So, and what is the change? What is the next one? So when we address our personal conflicts, we are able to accept the change. So as I said, change is inevitable, right? So it would definitely come. But if we consider change as an opportunity for growth, it will be easier for us to accept that change, right? So when we accept the change, if we deny and walk past the change, as I said, it can obliterate our growth process. You understand? But then if we, embrace the change, what is going to happen? We are definitely going to see a process of growth in our life, probably in a personal life as well as in a professional life. So you asked me a question: why did you move to this country? It wasn't an easy journey. It was very tough. There was challenges, and I was doing a 9 to 5 job, and weekends were off for me, and I had holidays and all of that. So it was very difficult, but I was happy in my comfort zone. But the change which happened, it was not easy. It was not comfortable, but I'm sure that this change would help me to grow in the future. So I think, so accepting the change is important, and not always thinking that change is scary, it is fearful. It can lead to positive outcomes as well, right? The next approach, which I feel, is adhering to the new norms. Like, this coronavirus has brought so many new norms, like social distancing, the virtual conferencing, hand washing, hand sanitization, wearing of mask in the public. So many new norms. So when we have to adhere to new norms, it requires three things. One is diligence, determination, and patience. Because every time wearing a mask and going out, it's not a practice which we have done before, right? So, but then if we are adhering to new norms, it is like we are protecting ourselves and we are posing less threat to the people around, right? And as a nurse, when we are working in an organization, and if we adhere to new norms, we are kind of giving less stress on the healthcare system, right? And when we adhere to new norms, we are able to persuade others to also adhere to the new norms. We can encourage others, like you had done videos on hand washing and all of that, because that can be a source of motivation. So so it's like we should practice what we preach, right? So if we're able to practice what we are doing, we'll be able to preach to others that you should do in that manner. So that is the third thing, adhering to new norms. And the last approach, which I feel, is accentuating your existing skills. Now, what is that? So this coronavirus has brought in so many new skills and technologies, and so many new things for us to learn, right? So as I said, two categories of people: one who are defined to change, and the other one who can embrace change. So people who are defined to change, would be difficult for them to learn new things. Do you agree? Yeah, it's difficult for them to learn because they are happy in their comfort zone, they are happy in their own shell, and they would not try to learn something new, and they would not appreciate anything new in others as well. So when a change comes, or when such unprecedented times come, we should accentuate our own skills. Like it might require us to unlearn something and relearn something. So it would require reskilling, upskilling. Probably we might have practiced hand washing in a particular way, and but this unprecedented times in coronavirus, there might be a different way to it, right? Hand sanitization, wearing of mask, wearing of person protective equipment. So that is very important, that we need to reskill and upskill ourselves. So I feel these are the some approaches, like first is like addressing our personal conflicts, and then accepting the change, adhering to new norms, and accentuating our existing skills. So so I feel these are the
Change,
approaches.
you should accept the change. That's
Yeah,
the most important thing, that you should upgrade yourself. You should accept the change. That's when you grow.
grow. Yeah, it's an opportunity for growth.
Yes. So,
Yeah.
let us also know about more opportunities that is there in your place now, your new place, UK.
Okay.
What are the
So
opportunities there for nurses?
yes. So who all are close to me, my friends and my relatives, I have told them that why not come to this place and gain some experience and go back to our country and contribute. So what I feel is that, as I said, nurses are recognized. That is very important. When you do something, if you get recognition for that work, you are more motivated to do it better and do it more. You understand? So that's what I've seen here. You get the recognition for your work, right? The second aspect which I feel is that the work hours, initially it was a big challenge for me, like 12 hours, we have to work at a stretch. It was difficult, but the good thing is to see the positive of that. Like, we just have to work 3 days in a week, so the rest 4 days are off. So it is like 3:4. So 3 days work and 4 days off. So it's a good work life balance. You understand? You can maintain a healthy work life balance. If there are something like the one which you're doing now, video and all of that recording, you need time for it, right? If you're working and managing your family, your children, so you barely get any time to do anything else which interests you. So having a 4 days off in a week is a good time to take time out or go out with your family and do something which interests you. So that thing I like about here. The other thing is, like, you have very good opportunities for growth. So if you're happy to get into research, there are opportunities for that. And if there's something, like, for example, if I'm very much interested for diabetes nursing, you have opportunities to become a diabetes nurse, or something like stoma care. So there's opportunity to do that. So there is no one is going to stop you, or no one is going to judge you, that if you don't know something, oh, isko to nahi aata, yeah, this person doesn't know, no one is going to judge you. So you can be open, and you can be open to your managers, you can be open to your colleagues, that, see, I don't know this particular skill, I need a training for that. And you should see the overwhelming response of the managers, that they would definitely book you for courses, to make sure that you get your skill updated, and you're ready to face the patient. So I feel that is very important, and I think that that should happen in India as well, because when we get into nursing, we are like so monotonous. We're doing our that same job again and again, so mundane. There's nothing newness in that, right? So when we learn new skills, and when we update ourselves, when we go to conferences and all of that, so I feel that is a good way here, because you have an opportunity to grow and express your concerns and worries, and tell confidently that I don't know something, because no one will judge you, right? And back home, when if you make a mistake, oh, you are so much judged, and you are reprimanded in the public, and you have to write so many apology letters and explanation letters. You need to meet hundreds of people to make, just to prove your point, right? But here, if you've made a mistake, just accept it, that you made a mistake. And there would be feedback sessions, wherein you'll be told that these are your areas of improvement, and you need to work on that. So no one will get to know that you did a mistake. It's not a big deal here. So what happens is like you're working, you when you go to work, there is no baggage, you understand? वो tension नहीं है कि क्या अगर मैंने कुछ गलती कर लिया तो what will happen, I'm going to get scolding, I'm going to do that. So that's not there. So you're very relaxed, Nancy. I'm so happy to be here, because back home it was, although it was teaching, it was good, but there was so much tensions, what if I didn't do this work, what if I don't complete my assignments on time. Even if as a student you must have faced the same. So it's quite relaxed here. So, and you have good opportunities to grow. So once you're band 5 nurse, you have opportunities to get into springboard courses wherein you can become a band 6 nurse. So it doesn't matter, you should have 5 years experience or 6 years of experience, or there is no, if you're ready, if you feel to take a leadership role, just enroll into the course and then bang on. You're there. Uh, because I still remember in our college when we had to do some particular like promotion, from tutor to assistant professor, there were so many criterias that you should fulfill these many things, these many years of experience, these many publications, these many things, right? They don't see the actual talent of the person. So here, if you feel confident that you're ready for this position, just grab it. The opportunity is there. It's how well and how soon we grab the opportunity. It just completely depends on us.
So I think our viewers are super excited to come to UK. And I'm also very much motivated the way you have, explained the things, because I have also met people who have a very negative feedback, that we have to work a lot, and uh,
So they are the categories of people who are defined to change and see. Yeah.
that, yeah.
We
So
need to see positive of our work. Yeah.
right. Thank you for joining in. And those who are watching us, if you have any queries, you can comment below or mail us or message us in our Facebook page, or you can mail us. So please like our Facebook page and subscribe to our YouTube channel, Medical Trip. Thank you for joining in.
Thank you, Ansi.